Counselor. Today is Thursday, October 11th, and the City Council Committee on Ways and Means is here to review and consider dockets 1442 and 1443. Docket 1442, message in order to reduce the FY19 appropriation for the Reserve for Collective Bargaining to $644,420 to provide for the Boston Public Health Commission for FY19 increases contained within the collective bargaining agreements between Boston Public Health Commission and Local 888 SEIU Counselors Union, as well as salary increases for non-union Boston Public Health Commission employees, and docket 1443. Message in order approving a supplemental appropriation for the Boston Public Health Commission for FY19 in the amount of $644,420 to cover the FY19 cost items contained within the collective bargaining agreements between the Boston Public Health Commission and Local 888 SEIU Counselors Unit, as well as the cost of salary increases for non-union BPHC employees. The terms of the SEIU Counselors contracts are October 1, 2016 through through September 30th, 2017, and October 1, 2017 through September 30th, 2020. The major provisions of the contracts include base wage increases of 2% effective the first pay period of January of each fiscal year. The agreements also include other benefits, including a new step beginning 2019. Non-union salary increases are effective as follows: 2% in January 2017 and 2% in January 2018. I'd like to remind folks that this is a public hearing being both broadcast live and taped for later review on Comcast Channel 8, RCN 82, Verizon 1964, and streamed at boston.gov/city-council-TV. I'd ask you to silence your electronic devices. At the conclusion of the department's presentation and questions from my colleagues, we will take public testimony. There's a sign-in sheet to my left. I'd ask that you state your name, affiliation, residence, and check the box if you do wish to testify. And also you can contact us through email at ccc.wm@boston.gov. I'm joined by my colleagues both from South Boston, District City Councilor Ed Flynn and at-large City Councilor Michael Flaherty. I'd like to welcome Justin and your team to present the fine points of this contract. Thanks.
Great. Thank you, Councilor. Good afternoon. Thank you, Councilor Shiomo, Councilor Flynn, Councilor Flaherty. My name is Justin Serrett. I'm the city's budget director. I'm here to offer testimony today on the two dockets before you and the appropriations they reflect. I am joined by my colleagues from PHC, David Susich and Grace Connolly. Dockets 1442 and 1443 are appropriation orders that cover the FY19 costs of the collective bargaining agreement between PHC and the SEIU counselors, as well as non-union increases for PHC employees. The combined $644,000 draw will be distributed to PHC to cover the FY19 costs of that contract and the non-union increases. Excuse me. As you remember, the FY19 budget passed by the council a few months ago included $38.4 million total in aggregate to cover collective bargaining reserve draws. So far in FY19, this is the fifth supplemental collective bargaining appropriation. The city has previously passed the City Council has previously passed appropriations for Teamsters, Park Rangers, Municipal Police, Patrolmen, and Superiors. With the approval of this supplemental, the remaining balance in the FY19 collective bargaining reserve will be $37.5 million. With the completion of this contract, the city will have settled contracts with 68% of unions. That includes both BPS and PHC. And I'll turn it over to PHC to walk through the highlights of the contract itself. And I'm happy to answer any questions you might have about the appropriation.
Great, thanks.
Good afternoon. My name is Dave Sussick. I'm the Director of Labor Relations at the Boston Public Health Commission. As was said earlier, this is two successor collective bargaining agreements for the Local 888 Counselors Unit. They collectively cover the period from October 1st, 2016 through September 30th, 2020. The Counselors Unit consists of approximately 82 non-supervisory employees who operate the Health Commission's emergency shelters and residential recovery programs out in Mattapan. The settlement generally aligns with the prior settlements that the Health Commission has reached with its unionized employees. It includes plans to roll out a reasonable suspicion and post-accident drug testing policy. It contains new provisions that are added to enhance the Health Commission's ability to more efficiently train staff, fill staffing vacancies, and run other administrative processes that go along with the collective bargaining agreement. For the economic terms are also the general wage increases are the same increases that have reached with other groups. Those call for 2% annual wage increases each January during the term of the contract, starting with January 2017. A new step at the top of the scale, which will most immediately benefit the most senior employees in the bargaining unit, and also an adjustment of the overtime language so that the time and a half overtime rate kicks in after these employees' full work week, which is 35 hours. The previous agreement, the overtime rate of time and a half kicked in at 40 hours, which tracked a statutory standard.
Thank you. Justin, you might know this. What's the balance in the collective bargaining
Sure.
fund?
It's about $37.5 million.
And obviously, we have 32% left to bargain with, and that includes, who are some of the bigger players in that?
So certainly the biggest ones would be the fire department
Right.
and the Boston Teachers Union.
Okay. And as you stated, this is very consistent with just about every single other collective bargaining agreement that has gone through our committee this year and even late last year. So appreciate the update. Councilor Flynn.
Thank you, Councilor Siomo, and thank you for your leadership on this issue and so many issues in the city. I just wanted to follow up on a couple issues. You mentioned the contract would especially benefit workers that are in some of the shelters, emergency shelters. Can you talk about what some of the assignments that they do or the duties they do, but are they exposed at times to conditions that might make it where they could get sick after a period of time, or they're exposed to any type of conditions where they might need a little bit more time off because of some of the environments that they're in?
So, sure. So the majority of the members of this unit work in one of the two emergency shelters that the Health Commission runs, so down at Woods Mullen or at 112 Southampton Street. Their basic duties are to provide for sort of the care and oversight of those shelters. So they're the people you meet when you come through the door. They run the search process through there. They're supported by security staff, campus police officers who are also on site, not in this unit. And they basically do rounds and they assist people with their general living needs and making sure that there's order and everybody's needs are being met. In terms of the time off benefits we provide, in addition to the ones that are provided by law, this contract for a full-time employee allows employees to accrue up to 15 sick days a year that also carry over. So they accumulate from year to year that are available for them if they need them.
Thank you for that. The reason I was asking is prior to this job, I was a probation officer at Suffolk Superior Court, and I would visit 112 Southampton Street in Woods Mullen. Sometimes I'd have to visit my probationers, and I saw the great work of the workforce there from Department of Public Health, and they were working hard. It could be a stressful job at times. It was often unpredictable, but they always kept their composure and were very professional and very compassionate. And I just want to make sure that we keep that in mind as well. when we go ahead with the next contract series, that these workers are really the heart and soul of Boston. They're providing so much assistance to our homeless community, and at times they don't get paid all that well, but they're really doing a great service to our city, and I know our city councils here are very proud of them, so I just want us to also consider that aspect as well.
Thank you.
Thanks. Thanks, Council.
Thank you, Council.
Flaherty?
Yeah, thank you, Mr. Chairman. Can you just take me through 6? It's City of Boston and the SEIU Housing Trust Fund. So for those that are viewing at home, what is the SEIU Housing Trust Fund? And it looks as though the Section 6, there's a specific agreement that was entered into on this matter. So can you just flush it through for me?
Sure. So the Housing Trust Fund was set up, I don't have the exact date, but probably about 10 years ago. So it's something that already exists, and it's a trust that's managed by a group of trustees, some of which are selected by the city and some of which are selected by the union. So they get together with the funds that are available to that trust to develop programs that support employees, particularly living in Boston. So they have a range of particular programs. One of the ones that was particularly popular, I understand, was fuel assistance in the winter, or home improvement projects, first-time home buying loans and things like that. We've been funding that trust fund pursuant to a formula that was agreed upon. It's about a nickel an hour worked, and there's a definition of hours worked, but it's about a nickel an hour work per employee. And every member of our local 88 unit is eligible to participate in that trust fund under the programs that are defined by the trust itself. And so what's really in the contract here about it is not establishing it, but we have 4 local 88 units. All of the members of those units participate in the trust fund. And there's a commitment here that if we raise the contribution rate from the employer for any of the units, then we have to raise it for the members of this unit as well.
Right. So it's not a situation where we'd have a high wage earner getting fuel assistance. There'd be a criteria as to whether you qualify for certain types of benefits, if you will, under the fund pursuant to the contract, I would assume.
That's correct. Although the terms of the fund and those programs are set by the trust, not through direct collective bargaining at the table.
Very good. And then, and this is probably a broader question for, I guess, all city employees with respect to, so I saw that there's some language in here with respect to drug and alcohol, sort of use and abuse and testing and after suspicion or after a work-related injury, which I think is important stuff, particularly if you're in the Public Health Commission, but any city employee for that matter. But if speaking more broadly, what is the policy that whereby a city employee has to disclose to their supervisor that they're involved in some type of criminal adjudication, criminal proceeding, if you will. So if it happens to a police officer, the police officer usually, public safety personnel usually makes the news, and they either get stripped of their gun and badge, or they're put on paid leave, what have you. However, rank and file city employees that may be involved in some activity, unless it makes the news, they kind of fly under the radar screen. And I guess I want to know the broader context of what's the policy by which a city employee who's representing the city, who may have been involved in something either on work or off work, but they're still representatives of the city, what is their reporting requirement when they're involved in a criminal matter, if anything at all? And if not, then I would argue that needs to be, we're moving forward with new contracts and new collective bargaining, that there needs to be something in there whereby a city employee has to notify someone within their department, that they're involved in something. May not even be their fault, it may be their fault, but we need to know about it, as opposed to be reading about it in the newspaper.
Yeah, that's a great question. I don't have an answer specifically on that, but I would say it probably depends on the different union that you're talking about. They probably have different rules that are either negotiated directly through there or their standard practice. But baseline.
But isn't there a sort of a superseding City of Boston employee manual of conduct unbecoming of a city employee?
There certainly is. I just don't, unfortunately, I don't have it in front of me to quote exactly what the requirements are to report under something like that. And I'm sure we can get that pretty quickly for you.
That'd be great. Thank you, Mr. Chairman.
Thanks. I think, Dave, you said 82 folks in the bargaining unit,
That's correct.
and how many non-union positions are there?
Approximately 240.
Oh, okay, all right. But that won't be, well, that's not coming out of the collective bargaining?
It's coming out of the general appropriate, the general fund, yeah.
Okay, thanks. And a lot of the other negotiations, bargaining units, the city had I guess you'd call it a cap on the sick leave buyback. Is that also part of this contract?
So my understanding of that with the city was that that was a cap on sick leave redemption at retirement.
Right.
That benefit is not in this contract, and we didn't create it.
Okay, so there is no sick leave buyback for any?
Not at retirement, no.
Okay, oh, interesting, okay. Well, great, thank you very much. You got Counselor Flynn.
I have one follow-up question. Are there any DPH employees that are also members of the reserves or the National Guard, especially in the medical care, medical field, the nursing program? Do we know, do we keep track of any of those types of?
I don't know. There are certain leave entitlements that come up under the law and some of our collective bargaining agreements. So when we have people like that who get deployed, we obviously comply with our obligations with regard to. So I know that comes up sometime, but I don't have I'm not sure we have a list.
Okay. And for Justin, one thing that would be important for me as a city councilor, someone that spent 25 years in the military, during these contract negotiations, can we also remember and keep in mind that some of these employees might be in the military reserves, they might be in the National Guard, and can we factor that in, making sure that they're treated fairly, they're treated with respect, and at least ask the question when you guys are negotiating, is there anything that we can do to help our reservists, anything we can do to help our National Guard, and anything we can do to help our military families is also important. So I just want to see if we can put that in the back of our minds as we go forward, that that's an important issue to a lot of families. We might not hear about it, but it's certainly an important issue.
Yeah, happy to take that back to the team.
Okay.
And
Thank you.
Thanks, Counselor Flynn. I just wanted to dive back into the sick leave. So do you have what is the policy? Can you describe the sick leave policy that SEIU 888 and/or the non-union employees? Is it different than other departments, I guess?
Are you talking about the sick leave redemption at retirement?
Yeah, like, do you have to buy it every year or something so that, because a lot of the collective bargaining agreements now have put the cap that you described earlier, so you can only buy up to so much at the end when you retire. Do you not have that program or that policy at all with these employees?
With these employees, no. So, but there is some variation by collective bargaining on that.
Okay.
But so for the non-union employees, they don't have that benefit, and neither
Right.
do the counselors in the local 888 unit.
Okay. So, and again, for clarification, I think we should try to keep, have consistent benefits and wages for as many of our employees. And so let's say they earn 12 sick days a year or whatever it is, prescribed by city policy, I would imagine. Do they, if I know some departments might say, if you don't call in sick at all in a year, you get like a week sick leave back. Is that part of the policy, or do you use it or lose it? I'm just curious because I think we should try to make it as standard as possible across our departments.
So there's variation there too. That we refer to that as an annual buyback program because it's
Right.
yearly. Again, the non-union employees at the Health Commission don't have that benefit, and neither do the counselors in this local 888 unit.
Okay, interesting. Okay. And Justin, we work together very closely.
Sure.
I'm just curious, are there many variations of that particular policy?
I would say we're striving to put that on the table when we're in these discussions, but it really depends on what the specific requests are.
You got dealt a hand, so I'm not putting it all on you,
No,
right?
absolutely, and we're
But
happy to.
I mean, just as a matter of practice, I think we should try to be as consistent with all of our employees as a matter of fairness, right?
Mm-hmm.
But I know each individual bargaining unit negotiates and
complicated,
gets
yeah.
different benefits and, maybe some costs, right?
Sure.
So anyway, well, I thank your thank you for your testimony today. I'll be reporting this out favorably on Wednesday. Want to thank you, Councilor Flynn, as pertaining to dockets. Oh, wrong one. 1442 and 1443. This hearing's adjourned.